75% of people think real estate agents aren't very trustworthy. The only way to change that perception is to change the reality. If you're looking for a career where integrity matters and you can guide others through tough, high-stakes decisions, come join us at Story Real Estate and help drive that 75% down to zero. I'm Chris, the owner and founder. Let's see if we have a career you'll love.
Hey y'all, welcome to Cross Politic. Good to be with you on the Fight Laugh Feast Network. Pastor Toby, Chuck Knox, and the Water Boy, and it's back. It's back.
No,
but you got to stay around to understand what's back.
I'll be back.
A couple things I wanted to bring to everyone's attention is the best place to sign up to be a club member. Is you can actually sign up in the app, but we worked it to where we prefer you sign up on the website so we can give Apple that 30%. You know what I'm saying?
We would like to keep.
So you go to fightlaughfeast.com, flfnetwork.com, and sign up there, and you'll get your access to the app.
Yeah.
But if you sign up in the app, we love you. We want you. We want you to be a club member.
It would sure be nice someday for me to have access to the app.
Send you the link.
One day.
You've sinned against
I would like to watch This America. It's my new favorite show, but I haven't seen it yet.
You know, you're a producer on that and a writer.
I know.
Yeah.
I know, and I'd love to see it someday. It'd be really nice. I clicked on that link that you sent me and it didn't work. Yeah. It says I already have an account, and then when I click on it, you do not have access.
Now, fellas. After the show.
You got to go through password reset, though.
I did it.
Really?
After
The annual Fight Laugh Feast conference is a conference like no other. The festivities kick off every year with beer and psalms. Which Christian conference that you go to every year does beer and psalms?
No.
I would like to know.
And which Christian conference gets their beer and psalms location moved
every year?
Which is
Fight Laugh Feast.
We just lost our beer and psalm location, so there's gonna be an update on the schedule for a new location.
This is like Darren Doan said. Like, this is ghetto. This is in the back alley. This is like you open the back of the trunk and you're like, hey, look at this. Check this out.
Look at all these CDs I burned.
Beer and psalms, bro.
We're just willing to have a party anywhere.
That's right.
That's kind of us.
And God's just making us keep it real.
Yeah.
It's like, don't get too big for your britches. Don't you planned it out, Gabe.
Shadrach, Meshach, and a bad Negro. We can have a party anywhere.
The Fight Laugh Feast conference is a gathering of rowdy Christians from all walks of life and from all over the country who want to glorify God and build God-honoring families, businesses, schools, and churches. This one-of-a-kind event transcends, you hear that? Transcends traditional boundaries. Who wrote this app?
I think AI did, actually. I think Garrison put it through AI and we're like, hey, we kind of liked what it said. Here we go.
That sounds like...
So I fired our marketing guy.
I was going to say, it definitely doesn't sound human. Yeah. Blending faith, culture, and a zest for life into a vibrant tapestry of ideas and interactions. Yeah, that's
incredible.
Attendees from all walks of life gather here to engage in spirited discussions, celebrate shared values, and forge connections. I would never have said it like that. But from thought-provoking talks to uproarious laughter and cross-politic live shows, the Fight Laugh Feast conference is a celebration of King Jesus. I would say that.
I need to double-check if that was an AI. I think it was an AI.
So it was either AI or our marketing guru, Garrison.
Garrison just got better at writing.
I doubt that part.
We think it's AI.
So buckle up as we fight, laugh, and feast with beer and psalms, our amazing lineup of speakers, our awesome vendors, and of course, our cross-politic live show on Christian nationalism with Pastor Doug Wilson, Joel Webbin, and none other than Stephen Wolf. This October 11th through the 14th, that's when the conference is. Visit fightlaughfeast.com. Sign up today, fightlaughfeast.com. Well, we're really grateful to have with us on the show today. I'm sorry, that was a really long introduction, but that was a hilarious.
It was pretty funny.
Hilarious. Dr. Jordan Vaughn is back.
Yes.
He's an internal medicine specialist.
He's our network's doctor.
Birmingham, Alabama. Sorry. Does he want to be our network's doctor?
It doesn't matter. We don't give that option. We just tell you.
He has over 13 years of experience in the medical field. Dr. Vaughn has directed his organization MedHelp to treat vaccine-injured patients or those experiencing long COVID. Dr. Vaughn, thanks for coming back on Cross Politic.
Thanks for having me, guys.
So,
I feel like that description. I think I want to go to that thing. I mean, that's like, it sounds like very Presbyterian / like using too many words in the thesaurus on words.
Yeah.
Anyway.
Yeah. Hey, it's in October. You need to bring your family. We're going to be at the Ark Encounter. You should totally. I'm inviting you live on the air right now.
Mm-hmm.
What are you going to do?
He's like, well, thank you.
What are you going to do?
Well,
we'll send you a note.
I've got a 5 and 7-year-old, so my life is
perfect.
Is not necessarily my own.
You bring the whole family. It's a vacation. Like Noah's Ark is for kids too.
Yeah.
And there's a petting zoo. Not lying.
That's true.
Oh no! Okay.
Yeah.
At the Ark, I think I could see that happening.
Yeah.
There
you go. So everybody's talking about a new variant.
Well, Alex Jones started it.
Yeah, and apparently a new vaccine even from Biden.
Yeah. Let's roll it. Real quick.
President, can you say anything about the uptick of COVID cases and new variant?
Yes, I can. Matter of fact, I signed off this morning on a proposal we have to present to the Congress a request for additional funding for a new vaccine that is necessary, that works. And tentatively, not decided finally yet, tentatively, it is recommended that, would likely be recommended that everybody get it.
It is recommended. We'd like it to be recommended.
No matter what.
Wait. So they already have. He said the new vaccine works already.
Which is pretty amazing.
Yeah, it's incredible.
So, Dr. Vaughn, help us interpret what is going on. Is there a new variant, and is there a new vaccine, and what are we to make of it?
So, interestingly enough, yes. I mean, there are new variants, and I think you could argue why we're having so many new variants. Obviously, viruses over time mutate, and they mutate both, at the sequential level, so they shift, and they really basically over time are going to cause your ability or your what I would call your immunity to find ways around it. That's really what they do, and so that's really what this virus, this new mutation is now. From most of the evidence, this mutation is, again, most viruses don't like to be deadly. They also don't like to be that virulent. They just like to be really infectious and propagate and replicate. And so when that happens, they're trying to find ways around so they can continue their madness. But their madness, as I always said, there's not many people to infect in a morgue. So it seems like these mutations are continuing to get what we would call less and less virulent. And that's probably the case here. Now, the vaccines changed a little of that because the vaccine causes some immune dysfunction or changes to people that cause, I think, these mutations to be a little bit more apt or adept at getting around the vaccine's protection, which, as we know, is not really protection. It's more, it's really not a vaccine at all. Really, it's some kind of gene therapeutic that allows people to make the spike protein that used to be around. Now, that's the funny thing that Biden's saying is this new vaccine is not a new vaccine. Actually, the VBAC, which is the vaccine and biological product with the FDA, they actually had a meeting about a month ago, and they all said, oh, well, it seems like this is the best way to get it the quickest, even though the actual mutation that this thing is targeting is going to be basically extinct by the time they're able to roll it out in September. So again, this vaccine that he's talking about is probably that vaccine, and it's targeted to something that will be in the past. So the mutation that they're seeing on the horizon is not what this vaccine addresses.
But Dr. Vaughn, will the vaccine manufacturer make billions of dollars?
So interestingly enough, that's probably why they want the government paying for it, because if they're relying on the free market where people actually have to want to go get this thing, I would say it probably isn't going to make money. Now, if they are relying on the government to buy your dose, even if you want it or not, yes, they will make a lot of money.
So, part of me,
the vaccine uptake since people have started to kind of wake up from their slumber, the vaccine uptake is pretty pitiful.
Yeah.
So
without government mandates and businesses pressuring and all the rest of it, people are not that excited about it.
Yeah, people realize a vaccine that makes you feel like crap for 3 or 4 days, and then also doesn't protect you, and also can cause all kinds of bad things like thrombogenic complications, heart attacks, strokes, those kind of things, aren't things that they're signing up to get.
Right. Yeah, it's just a real downer, actually. You're like,
Yeah.
It doesn't work. You'll be sick for 4 days, and then you'll get myocarditis.
and die.
Yeah, exactly. And you'll be even more likely to give it to your grandma.
Oh, my God. Oh, gosh. So
this isn't...
I hate this conversation right now.
Yeah, I do too. Part of the reason this conversation is happening is because Alex Jones, he got on the show and he started talking about the fact that get ready, lockdowns are coming. He didn't even talk about it, the variant, which his audience doesn't care about the variant. They're more concerned about, are we going to get locked down again? Do you think that they are stupid enough to try something like that again?
I mean, I think, just looking at my own patient population, and mine probably would be the most skeptical in the world. It's amazing that how many people are popping their mask back on.
What?
And again, it's just they're very few people think for themselves anymore and just are waiting for being told what to do. And the problem is that sets up this kind of environment where you're going to just go along with what I would call whatever the mass media is going to tell you. And the problem is the mass media, the government, industry, the FDA. At this point, they're all the same function. And I think that's the biggest problem is there's no one checking the power. And that's, again, Biden shouldn't have any comment like that. Again, he is a senile old man. I give him some deference that's probably not really what he thought about. It's probably what some, underling told him with, it's like telephone with him. I'm sure somebody said, hey, there's a vaccine on the way. And he, threw out something that makes no sense, nor should he even be commenting about it. It's not a new vaccine, first of all. And second of all, it doesn't work. And third of all, not everybody, first of all, in my opinion, no one needs it. But in even the most vaccine, people that are pushers of vaccine would tell you not everybody needs it either.
Right.
So.
Okay, so let me just kind of lay out for you, Jordan, my fear here. Okay, because the first time was the lockdowns that they were going to come and they had tried to control us. It was all the stereotypical, aluminum hat wearing stuff that people would say, right? Hey, they're going to try and control you through getting a vaccine. If you don't have a vaccine, you can't eat. That almost happened, right? So it's kind of funny. Yeah. But here's my second fear, that they won't come the same way they did the first time because that really wasn't effective enough. They didn't do all that they needed to do. My fear is that we actually might have something that really is problematic as a variant or as a virus. And everybody who pushed and didn't push last time but wish they would have pushed will push and say, I'm not doing anything. I'm not going to pay any attention to y'all and I'm going to do my own thing. And then all of a sudden, the things that we thought we should have seen in the last pandemic where people kind of fall in the street, we actually have some sort of real viral problem. But because of what the relationship, how things happened last time, nobody wants to listen. So then nobody does any research and everybody just does their own thing. And so you're sitting here saying, I messed up. And then we give it all over to the federal government and say, do whatever you need to do, fix it because this one's real.
Yeah.
And the issue last time wasn't about whether or not the issue was real with the virus or not. It was whether or not they had the authority to do what they did because of the virus. That was always my take on this. It didn't matter if it was real or not. That we have authority lines, that we have a law that we should follow and keep. Now I think if something really does happen, people really would give all the authority, say, just fix it. I don't care what it is. And so we don't have any institutions that we can trust that we might even know ahead of time if this thing is real or not. So what do we do?
Yeah, I think one of the things that you can, thankfully, the ability to share information across the globe allows us to find out somewhat the truth. And I think that's one of the things that was pretty obvious. And I think that's what back in the day, if the CDC said something, it would be very hard for you to find out what some lab in South Africa was doing. But now, unless they shut down the internet, which who knows, but a lot of the stuff that's actually sourced out there allows us to really get a clearer picture. And that's really what, even there's somebody not too long ago that was, even our state health officer was saying his biggest problem was the democratization of the news. And first of all, it's funny that was his issue, because he did the exact opposite. They controlled the news, but the democratization of the news really is allowing information to flow to people without a central hub. And I think that is still available in medicine. The problem is most doctors are lazy and haven't, gone back to finding out information for themselves. Instead, they depend on, third parties to tell them the news, just like many of the doctors would say something and I'd be like, I think that was on the news last night. That's not in the literature. It's kind of funny that CNN was their source as opposed to the actual hard evidence. But as long as the hard evidence exists, I think there's hope. I hope that they do not try to knock down hard evidence. I think Twitter is a great example for me as a physician. I think I used Twitter never prior to the pandemic, but now being able to share information, talk to doctors from all over the world is really gives you the ability to figure out things that they're seeing, that you're seeing, and actually come up with the answer. So I think there is hope there. So I don't like to be totally negative on that front, but I do think people are going to realize, first of all, Ebola and all these kind of deadly viruses, for the most part, as I was talking earlier, viruses that are really transmissible aren't really deadly because they can't be really deadly, because if they're really deadly, they don't transmit well. Does that make sense?
Yeah.
So, so again, that's, the reason that Ebola is probably never going to be a big issue here is because the person that has it usually isn't, is pretty sick and dead before he spread it to a lot of people. So, in the same type of way, that's why you knew the coronavirus in terms of how it spread, especially asymptomatically, that the statement that it was 2 to 3% of the population that got it was dying was just a complete overstatement and completely ridiculous. So it'll be the same thing. I think you'll be able to tell. I moved back to 2020 as we were all scared. You really didn't know anybody that had actually died or even had COVID until it kind of got wider spread, yet they treated it like, your city was dying internally and everybody should be shut down. So I think the overreaction will lead to people, again, outside of them controlling our currency and then making a social credit score. So that's one of the things that I hear is that's also, in a line with this is to have the shutdown be, coincide with, a digital currency and all of the above. So that would be a little different story.
I gotta go get my full hat. It's underneath the table waiting for me.
I want to actually follow up on your comment about Twitter. I'm curious, what are you seeing? I would like to think
it's called X, by the way, y'all. I just want to say
Twitter. It's Twitter forever. Twitter forever.
Okay.
Power.
Yeah. Tweet.
Twitter power. I think I would like to think that for Joe, I don't know, generic population of America. I know there are sort of silos of certain CNN populations, but I'd like to think for most, maybe a middle America, you want to call it. There's been a whole bunch of people who are like, just come and try that again. Just come and try that again. We're not going to do that. We're not going to be masking up. We're not going to be locked in our homes. We're not going to close our businesses down. I'd like to think that if they tried that, it would go terrible for them, at least in most of Middle America. But I'm curious about the medical field in particular. It seemed like, one of the major problems was that there was, I know there were valiant few who refused to go along with the narrative, and many of them lost their jobs. Many of them were forced out, except for a few that are in private, have privatized, like yourself. What are you seeing broadly in terms of the medical professional field? And is there any kind of bounce back? Is there any kind of pushback or some sanity rising?
So one of the problems is you have to separate what a doctor is going to tell you under the auspice of his employer versus what he's going to tell you in private. And I think most of physicians in private know that they were duped, know that they gave out bad information, are starting to realize, or even have already realized, that they need to be more circumspect when it comes to thinking that the CDC, FDA, and all of the above are, these perfectly white hat, like meaning they're these agencies that are above reproach. They aren't. They're political arms. And if there's nothing that's ever exposed them more, it's been the last 2 to 3 years, that they are nothing but political bodies with political ideology that, for the most part, appear to care about safety and appear to care about, the infections in a community. But really, all they really care about is diversity, equity, and inclusion. Meaning, like, what I mean is they are political. They are political bodies. And so I think doctors are coming out of their shell and realizing that, because I think a lot of people, most doctors are not getting boosters. A lot of doctors, especially ones that were even as pro as can be, now have friends that are injured by the vaccine. So I hate that that's the way that people have to be woken up. But when you have a loved one or you have a friend, even within our organization called the FLCCC, a good bit of the people that are the biggest part of our education to other providers that are just brilliant people, they found out by getting injured themselves, or a family member did. Wow. So it's when you're talking about a vaccine that has an injury rate that's significant, probably in the single digit, almost double digit percent, depending on how many injections you've gotten. You're talking about, and the healthcare workers are required to get it. You're going to have a lot of them that are injured, and I think that's what's been most eye opening. It's one thing to tell a patient that they're wrong or that they must be, imagining something, but when you yourself are injured and hurt, you can't deny it.
Yeah. Did you want to? Because I got another question, and then
I got another one too.
Okay. Do you? Okay. Yeah. Hey, so I just got to ask you, Doc, if they actually shut things down again, what are you going to do?
So, I'll continue to do what I did, which was to take care of people and speak out against it. That's typically what I did in the past. So, a lot of times I would help small businesses reopen. Again, just going against it. I make sure my church is open and understanding that just because the Resource Center for the Baptist is friends with Francis Collins, that doesn't mean that he is a man that fears God and wants the best for you. So,
ouch. Oof. But do masks work?
So, masks are good at stopping your spit or somebody from spitting on you. That's about all they are. They stop physical things. So most people wear masks in surgery because they don't want the guts and nasty stuff popping in their face or hitting them in the mouth. Fair enough. In terms of their ability to impact respiratory viruses, even the CDC and FDA, or the CDC recently with these fire outbreaks, would tell you that a mask isn't useful for fires because it doesn't prevent the particles that are in the smoke that causes smoke inhalation from, it's still able to get through. That sounds familiar, except for that those things are even bigger than what they're supposed to stop when we tell them that it stops viruses. Yeah. If that makes sense.
Yes, we used to say it's like trying to stop mosquitoes with a volleyball net.
Yeah. Dr. Vaughn, where can people? Just so you know this, man, I've spent time talking to you around a table, hours listening to you go through vaccines, vaccine injuries, and the virus, and so you're one of the few people that I trust that I think people need to be paying attention to. Where can people follow your work or pay attention to what you're doing so they can have a true resource?
So I will say we just have started a foundation just basically for researching a lot of this, and really it's called Foundation for Spike Protein, long COVID spike protein and microvascular research. We've actually narrowed it now, called the Microvascular Research Foundation. By the way, it's one of the places that we're able to start researching a lot of this on what's impacting the small vessels. Vaccine is one thing that does that, but my silver lining in a lot of this is hopefully we can learn from what the vaccine does to the small vessels to help people who have small vessel damage to begin with to live a fuller life, in terms of not necessarily live longer, but not be the president of their memory care center. And so that's kind of the goal that I have here. So,
Dr. Vaughn, thank you so much for joining us on Cross Politics, taking the time out to talk to us. Appreciate you very much.
Yeah, man.
Have a great evening, sir.
Jesus is Lord in public and in private. Every area of life must be subject to his lordship, and our use of technology is no exception. What captures our attention on the screen either glorifies or dishonors our Lord. That's why Accountable to You, that's the word accountable, the number 2, the word you, is committed to promoting biblical accountability in our families and in our churches. Their monitoring and reporting software makes transparency easy on all of your devices, so you can say with the psalmist, I will not set anything worthless before my eyes. Guard against temptation with Accountable to You and live for God's glory. Learn more today and try it for free at Accountable to You. Again, that's the word accountable, the number 2, the word you.com/FLF.
If they tried this again, things would be a lot different, right? I think there was some fight that we had in us that we didn't know that we had. And there were some things that we did since 2020 that give us a whole different sort of perspective. I didn't know who to do business with, right? But now we have, the freedom economy? Yeah. With Michael Seifert and Andrew Capuchet over there.
Red Balloon. And what's Seifert's group called? Public Square.
Yeah. And so you have that, and you have a bunch of people that have moved now to strong environment.
We've found a lot of our people.
Yes, we regathered. So it would look a lot different. It would look a lot different. But my thought is so what are you going to do if you hear it? When we saw it coming the first time, we were like all over it. But what do you do if they say, okay, we're going to shut down again? I even saw that they're trying to bring back masks by the time we do our conference. And I'm like, I'm not jumping on a plane with a mask on again.
No. That's for true.
I'm making it. I'm like, okay, we got to do the conference, but I don't want to. So what do you do?
The cool thing is our airplane, because we're flying out of, I think, Spokane together.
Yeah.
And I think there's like 20 of our people on the plane.
We just all
not do it.
Just
like, nah.
I got 9 of them, so there's at least 9 of us that are not going to do it.
We're all flying out to the Ark and
Yeah, you're right.
Pretty much, we probably could have chartered a plane given how many people are coming.
Is it time? I guess if it happens again, I think everybody's got to say, we're all going to meet with Gabe in cell block C4.
Yeah.
Right? Like that's where we're all going.
Yeah. We're singing Psalms.
We're going to be singing Psalms. But I wonder now, do you have enough Psalms memorized since the last 3 years?
Yeah.
Right? Have you been singing them? Have you been fighting in that way? And I wonder how many people. I would love to see Psalm sings happen all over city councils. And I just wonder, have we done enough so that we have enough, something to fight with if it comes time? And if we do, why would we wait until they bring in another lockdown to start engaging? As if things have gotten so good since then. Right? Why would you wait then?
Yeah.
And it's just made me think about
this is one of the this is what the devil does on so many fronts. Does this in marriages, does this in relationships, I think does this even in national and cultural things is when God is at work convicting people of sin, we tend to repent just enough so that it doesn't hurt as much as it did before.
Right.
It's just so that it's not as uncomfortable as it was before. And then so you can have a marriage that you begin repenting and you begin rebuilding things, and then it's not as bad as it was before, and you stop. You settle for that. Or again, the same thing, like they're not requiring masks in every store. They're not requiring masks in the airplanes. And you say, okay, that's good enough. You're like, no, you don't understand. Like if you don't repent all the way down, if you don't keep going until it's all clean, the infection just comes back.
Right.
The demon brings his 7 friends.
What did you fill this thing with?
So I would like to think that there's a whole bunch of places where like if they do this, like there's a whole bunch of us are going to say no, absolutely not. Yeah. Not even for a second. Let me think about it. No, not even for a second. So I do think that it's interesting. Like I like how you're thinking though, Knox, in terms of, is there a chance that there'll be some other variation on the play? We're talking about viral variants, but how
Vaughn also brought it up with national currency, digital currency stuff,
sure.
Stuff like that.
Is there an off-speed pitch of the same play? Because there are a bunch. The disease we have is not COVID.
That's right.
The disease we have is a defiant humanism,
right,
that hates God and hates Jesus and wants to be God. And so because it wants to be God, it wants to run everything. It thinks that it is the solution, it is the savior, it is salvation, it is the gospel. And so that's why they want to control everything.
Yeah.
And so I think that we should be expecting the next play any minute. But the only way to be ready for that play, you're right, is to have, you need to be practicing just righteousness now, holiness now.
You can.
Don't stop. Make it clean.
All the way down to the ground, repentance. Yeah. If you're single, get married. If you're married, have you some kids. And if you have kids, go baptize them. Until tomorrow, love God with all your heart, soul, mind, and strength. Love your neighbor as yourself. Go fight, laugh, and feast. This is Cross Politic.
It is the duty of the free man to resist tyranny at every turn. Every man will either watch his freedom stripped away or take action to protect what he loves. Introducing the A3, the newest revolutionary body armor from Armored Republic. The A3 is the new standard for lightweight multi-hit body armor. A3 plates are incredibly light at 4.6 pounds. The patented design captures fragmentation while remaining multi-hit capable. The A3 will stop up to M80 ball, yet comes in at only 0.7 inches thick. The A3 is the thinnest NIJ .06 compliant or certified composite standalone plate that includes the drop test. The A3 is the first of its kind, patent pending, that combines an alloy strike face with polyethylene backing, revolutionizing body armor technology by providing strength and durability while remaining sleek and maneuverable. The A3 is the new standard in lightweight body armor. The fight against tyranny just got stronger.